Today's feature presenter is Jerome Dixon, who is our chapter's chiropractor. So Jerome's been in business for more than 20 years and is an expert in his field. Together with his wife, Kate, they have 2 children, Max and Tom, and a pet called Teddy. His hobbies and interests include running, swimming, cycling, surfing, and skiing. And his previous job types are all around what he does today, and that's what makes him an expert in this area: headaches and migraines, general muscular, skeletal and spinal medicine and rehab. His burning desire is to grow his practice and get staff running his practice. Something that we might not know about Jerome is that he has been consulted and has been on the Victorian Government Better Health Channel, and is a health content partner and editor. His key to success is experience and professionalism. Something that I'd like to bring to everyone's attention is that he does offer a comprehensive review via his website, and he can do that in person via Zoom or FaceTime, so you don't have to be in Melbourne, where he asks and analyses the answers to the questions, which will identify what could be causing the headaches, because there's a lot of different things that can cause headaches. And there isn't a course that provides that teaches people about headaches. So his 20 years experience has made him an expert in this field. So over to Jerome for his presentation, which I'm sure we're all looking forward to. Thank you.
Thanks, Helen. That was a very flattering introduction. I appreciate that. Thank you. Today, I just wanted to talk to you about headaches and migraines. And it's one of the most common reasons people go to their health professional is for head pain. So I did send out an email a little bit earlier, so please check your inboxes for the email. It tells people how to get on to me for an assessment or to come and see me. There's some links there. But in headaches and migraines in general, your body's way of telling you there's a problem. So it's really important to look at what those problems might be, to take a comprehensive history, and to give the patient some information that's going to help them to help themselves, but also sending them in the right direction. My background, I have a Bachelor of Applied Science in Chiropractic, and but prior to that, I did a Bachelor of Science in Biochemistry and Microbiology. And prior to that, I was doing dietetics. So I was a student for a long time. And of course, when I graduated, the first principal that I worked for wanted me to go and do postgraduate studies in chirodontics, which is headaches and migraines in relation to jaw and cranial issues. So I did a lot of work in that area prior to setting up my own practice. That led to the formation of headache.com.au in 2000, and that came into being because I brought together the professions that I thought could offer information, insight, such as neurologists and ear, nose and throat surgeons and psychologists, other chiropractors, optometrists and what have you. So it's really important to recognise that headaches and migraines transcend professional boundaries, and that a number of professions can help with headaches and migraines. The trick is getting a comprehensive history that brings together the necessary expertise to send that patient in the right direction, to help them to help themselves, but also to give them a diagnosis. Most patients, when they have headaches or migraines, they think something serious, they think something exotic, they think the worst. But 99 times out of 100, it's your body's way of telling you that there's irritation in the head, neck, jaw, or even more broadly in the body. So it's really important to look at the headache and migraine as a symptom of something else that's going on. And even more importantly, there's often a combination of factors that interact. The Better Health Channel approached us after we started the headache.com.au site and asked us to approve content that they were putting onto the Better Health Channel when they were setting up. So we did approve a lot of the content, and I've done a lot of public speaking on headaches and migraines because it is an area of passion of mine, and it does bring together a series of expertise. And I love it because it's a forum in which professions should collaborate and do collaborate for the benefit of the patient. I've been in private practice since 1996, so I've got a few years under my belt. And as I said, I'm really enjoying the Headache and Migraine Forum as an area of specialisation. Headaches and migraines are usually related, and there's a spectrum of, if you like, headaches which can become more migrainous in their quality and the type of pain, but they almost always have similar causes. So it's really important, if you're looking at headaches or migraines, to look at similar areas. And those areas can range from musculoskeletal to dietary to hormonal to visual, to like optometry issues. Really important to look at headaches and migraines through the same lens, but to look at them as a different expression, or if you like, a migraine is a headache with vascular symptoms. So it's important to look at headaches and migraines as having similar pathophysiology, if you like, or similar causes. They're very, very common. It's one of the most common reasons people go to their doctor and specialists, if you like. But often that's where it stops. Patients often are given a negative diagnosis. It's not a brain tumour. It's nothing. It's not meningitis. It's not life-threatening. So therefore, let's give you some medication. Really just masking the symptoms, and you should be looking at the underlying causes. And the majority of cases can be relieved, if not cured, by addressing those causes. So it's important to look at the range of possibilities. Medication, well, big pharmaceutical companies, want you to take medication. That's what they do. But maybe look at it in the context of medication is a useful tool for pain relief, but it's not going to cure the actual cause. And I think we grew up with a programming, if you like, that we're taught to think that medication equals solution. Medication is a useful tool, great for relieving pain, but it's not where the diagnosis should stop. The diagnosis basically is looking at the range of possibilities, not just one perspective, not just looking at the brain and saying, well, the brain's normal, the MRI shows there's no tumour, therefore there's nothing else wrong. You cannot see neck stiffness, eye irritation, food triggers, bad postural habits. You cannot see functional issues on a scan. So most scans are only used to reassure the patient and to give the practitioner a thorough assessment, and to let the patient know, to reassure the patient, to let them know that there's nothing serious going on. What the most important tool with headaches and migraines is the history. You can actually get the diagnosis 95, 99 times out of 100 by taking the right history, by asking the right questions. For example, the onset, what started? When did they start? What were you doing at the time they started? Was it a new job? Had you had trauma? Did they begin slowly? Did they creep up, or did they begin suddenly and severely? Are they in the mornings? If they're in the mornings, they're more likely to be things like neck issues or blood sugar issues, perhaps if you had an early dinner the night before, or it could be sinus congestion, lying in bed. Or if they occur in the evenings, is it more related to stress, to food triggers, to eye strain after a busy day on the computer? So the onset and the timing and the frequency gives you a lot of information. If they're happening daily, are they happening at the same time of the day, like in the afternoon or at lunchtime when you perhaps haven't had breakfast, and so you're becoming hypoglycemic? Are they constant, or do they come and go? Do they occur monthly? Monthly, for example, is a lot of women would assume that a monthly headache or a migraine was menstrually caused. Well, there's actually research to say that menstrual migraines are a consequence of estrogen dropping away prior to menstruation, making women more vulnerable to pain, to a headache, to a migraine at that time of the month. So it's really important to look beyond the timing and the actual the time of the month that they're occurring and say, okay, what else is going on? What else could be contributing? What else could be irritating? The location is important. Is it in the temple? If it's in the temple, like up in the side of your head, it could be related to the jaw. It could be related to inflammation of the artery called temporal arteritis. It could be referred pain. The most common reason people get pain in the temple or the top of the head is it's often referred. Pain itself, the actual type of pain, the quality of pain is not a good indicator. A serious pain, like a really severe pain, can be something like a cluster headache, whereas a slow progressive pain can be a little bit more suspicious of something seriously wrong. So it's really important to take a comprehensive history, to look at the whole patient, to look at across systems, whether it's musculoskeletal or whether it's neurological or whether it's dietary, postural habits. Really important to look at the whole patient, take that history and then give the patient a diagnosis. Scans and what have you are useful, but most of the time they don't show functional issues, and most headaches and migraines are functional issues. So what I said before a bit earlier was thinking horses, not zebras. When you hear the sound of horses' hooves, patients often assume the worst. They often think zebras. So I like that saying because it does let you know that the most important thing is to think the obvious. We often don't think the obvious when it comes to head pain. So the history is 90% of the diagnosis: the onset, the frequency, the duration, the location, the pain, the timing. When does it begin? Like that gives valuable clues. And I can help to decipher those clues and to ask the questions that would progressively lead down to a diagnosis with headaches, with migraines. Of course, it's great to have information from other health professionals and to assimilate that and to give the patient an overview. And that's what I do in a full case review. I provide an overview, previous diagnosis, previous treatment, as well as my assessment through the history. Okay, a great way to so the severity over time. In other words, if you have a severe headache or a severe migraine, chart it. Have a horizontal scale that goes day by day and try to use that scale to give you like a timing and a frequency and a pattern that can help you to predict when the next headache and migraine might happen, and are there factors that coexist at a certain time of the month or a certain time of the day where you actually get a headache and a migraine, and it coincides with triggers, it coincides with various activities that you're doing. So a headache and migraine chart is a great way to start. Okay, so as I said, the severity is not a good indication of the seriousness. The history is super important, much more important than any scan, and getting that information and assimilating it, and then the examination confirms the suspicions of the diagnosis. But as I said, the examination is only a small part of it. The history is the key, and the diagnosis is a label. Often a diagnosis is helping to categorize the type of headache, the type of pain pattern, but what really matters is looking at the actual underlying causes. And a diagnosis is very easy to get caught up in a label, but you've got to remember that diagnosis is a descriptive term giving you indication of what could be causing it. It's really important to identify what is actually aggravating headaches and migraines and to solve that puzzle. The International Headache Society posted the latest categorization in 2018. They identified over 200 headaches and migraine variants. It's impossible to know them all for any specialist or any healthcare expert. What's more important is the underlying triggers and aggravating factors that lead to that diagnosis, if you like. Okay, so 99% of brain scans, MRIs, they're normal. So why do them? I ran a survey in, I think it was 2016, and asking patients whether they had a scan and what the scan showed, and 95% of them said it showed nothing. I think the American Headache Society did a similar scan, and they found that most scans showed nothing. So why are practitioners doing them? Because we need to make sure we don't leave any stone unturned, and to also give the patient reassurance. Most of the time it's to give patients reassurance. So don't get too caught up in a scan. Scans are useful, but they're not they're not necessarily the best tool for a diagnosis.
1 minute to go.
Thank you. X-rays similar. X-rays can show degenerative change, which can help to form a diagnosis. But once again, there's often other factors involved. So it's really important to look at the whole patient, the whole picture. As I said, the surveys that I ran helped to identify what patients were finding. That was scans don't really show much in most cases. Multiple triggers is really the key. Looking at multiple triggers and making sure that you give the patient a comprehensive overview of what factors should be further investigated. And that's what I look at in my full case review. The neurology of the head and neck, it's all plugs into the same switchboard. That's why often face pain can be perceived in the head, neck pain can be perceived in the face. The neurology is the reason for that. Patients present with symptoms. Symptoms are an overload of irritation. So treat it that way, an overload of irritation. Look for the irritation. What's going on? Stiffness, dysfunction, fatigue, irritation. Are there problems that can be addressed that rather than just medicate? What I do is pretty much all history and looking at examination and diagnosis. Treatment is a solution. It's not about just addressing the symptoms. And I sent an email out this morning regarding links to the Headache and Migraine Full Case Review in person, or the Headache and Migraine Full Case Review, which can be done remotely for someone who's interstate or overseas. Thanks for your time and thanks for listening.
Let's all come off mute now and give Jerome a round of applause for his really informative presentation. Thanks, Jerome.
It was really good.